Hi, how are you today?
Good. How are you?
Good. My name's Jen. I'm going to be your nurse practitioner student taking care of you today.
Okay.
All right. So go ahead and have a seat for me. What brings you in today?
I was on a vacation recently and
Okay.
went scuba diving, and I noticed after one of the surfaces that I was having problems clearing.
Okay.
So there's a lot of pressure built up in my right ear, and that's kind of been ongoing for the past 12 days like that.
Okay. So for 12 days, it's kind of felt the same.
Mhm.
Okay. So has this ever happened to you before?
I've dove before, and I've noticed there's like trouble sometimes clearing as quickly as other people, but no, nothing that was residual, nothing that carried on after the dive was over.
Okay. So 12 days ago, was that just one dive or multiples?
There was multiple dives in the day, but it was
Okay.
after the final dive.
After the final?
Mhm.
Okay. And you said your right ear.
Mhm.
Um, how is like how does it feel? Is it a sharp pain? Is it
No, in fact, it's not so much painful. It's just more of an annoyance. It's like a block there constantly.
okay? And do you feel like it decreases your hearing?
Definitely.
Okay. Does anything make it better or worse?
Yeah, I go through the similar steps what they teach you when you're clearing. Trying to open my jaw and clear the airway. It'll clear momentarily, but it's like the pressure builds right back up.
Okay. Have you tried taking anything over the counter for it? And have you noticed at night or anytime during the day if there's any discharge coming out of the ear on your pillow or anything?
No.
Okay. And prior to diving or anything, were you congested or did you have any colds before this?
I have season allergies, but I didn't notice anything abnormal.
Okay. All right. Sure. All right, so we'll go ahead and take a look at that today. Since you haven't been with us in about 9 months, I'm gonna go ahead and do a full head to toe assessment today.
Okay.
Just for your physical, make sure everything's looking okay. Do you have any other complaints or is anything else been going on?
Yeah, I've been seeing a ophthalmologist pretty regularly for what was determined to be I guess, a version of herpes. Was affecting my vision, possibly even scarring, not possibly, but scarring my right eye.
Okay,
So they do have me on a daily Valtrex, as well as a lubricant that like natural tears that I take as needed.
okay. And how about the vision to that eye? Do you feel like that's been affected?
Yep, I actually had a follow up, and was recently prescribed glasses that I have to wear mostly as needed, primarily at night.
Okay, sure. And when's the last time that you saw the ophthalmologist?
Ophthalmologist was about 6 months ago.
Okay. And do you have a follow-up plan with him again?
I believe so. I need to call to schedule, but yeah, it's the last time I saw him. It's pretty consistent what he's seen, and nothing is progressively getting worse. So
Okay.
he's at a point where we're going to increase the amount of visits or increase the duration between visits.
Okay, sure. And so while we're on the topic, do you, besides for the Valtrex and the lubricant, are you taking any other medications on a daily basis?
No.
How about any supplements or anything? Any vitamins?
No, not really. I go incrementally with like multivitamins and supplements supported for like physical fitness health, but I haven't been doing any of those in a while.
Okay. And do you have any allergies to any medications?
Not that I know of.
Okay. Any other allergies? Are you allergic to any foods or anything?
I'm not.
Okay.
I don't like beans, but I don't think I'm allergic.
Beans are good for you. Lots of fiber.
So I've heard.
All right. So past medical history, besides for the herpes zoster to the right eye, any other chronic medical conditions?
Chronic, no.
Any past medical history?
Yeah, about 3-4 years ago, 2018. I suffered a moderate TBI.
Okay. And what happened with that?
It was just I was hit, and then upon impact of the ground. Yeah, I don't know. That's the story that I remember. I
Okay.
just woke up in a hospital 2 days
Okay.
later.
So you had loss of consciousness.
Yes.
Okay, and how many days were you hospitalized?
2.
Okay. And did you do any therapies or anything after that?
Speech therapy. I've had a follow on with the neurologist, and then they even had a specific person assigned that was kind of tracking, not specifically the neurologist, but somebody assigned to that department that was kind of tracking my overall health as it was progressing. So it was about 90 days for both of them. And then upon clearance by the neurologist, I was seen by a specialist that did my cognitive skills a test.
Okay.
Yeah.
And how have you been since then, do you feel? Any deficits anywhere?
I know that my speech doesn't feel like it'll ever be 100% again. And then recently I've kind of noticed sort of a social anxiety.
Sure.
So like large settings, I definitely, yeah, I'm a little angsty, I guess, a little, not angsty, but anxious.
Okay. Well, before we leave here today, I can give you some information if that's something you'd like to seek out, maybe just some therapy, just to talk about what happened and maybe help with those feelings.
Yeah.
Okay, also, so have you had a follow-up with neurology or anybody since this has happened?
I have not.
Okay,
They did recommend 2 years after, so it's about that time.
yeah, I would definitely try and do a follow-up appointment with them, just so everybody can be on the same page and make sure there's nothing that you need to go from there, okay?
Okay.
So we'll put that in for the referral too, so you can remember to follow up with them as well.
Perfect.
So as far as, do you smoke or drink?
Both. Yep.
Okay.
Smoke, like an e-cigarette, vape. Have been on and off for the better part of 10 years, and drink moderately.
Okay, how many days a week do you say you drink?
About 2.
And on those 2 days, how many drinks?
No more than 3.
Okay. All right, great. And as far as any recreational drugs, do you use any?
No, none.
And what do you do for work?
I'm active duty military.
All right, how long have you been in the active?
About 19 years.
Well, thank you for your service.
Thank you.
All right, any exposures, environmental hazards that you could be exposed to at work that you're aware of?
Yeah, definitely loud noises. So yeah, that's probably the biggest one. I work around a lot of machinery.
Okay, do they ever do hearing tests there?
They do. There's a program I'm enrolled in to check it.
Okay. Great. And as far as your home life, can you tell me a little bit about that?
Yeah, married, kids. Home life is great. Yeah, no concerns there.
Okay, and that you feel safe at home?
Yeah, when the kids are locked up, absolutely.
Seriously.
No, I feel great.
Okay. And as far as financially and everything, not to get into the personal side, but you feel food secure, you have enough food, you
Yeah.
have power, everything like that is in working order?
100%
Okay, and for safety, when you're driving, do you wear a seatbelt?
all the time.
All right, you have smoke detectors in your home?
We do.
Okay, excellent. As far as any mental health problems, I know you said a little bit of anxiety probably from the TBI that happened. Any other depression or any other things that you can think of?
No,
Okay, no thoughts of wanting to hurt yourself, hurt anybody else?
not at all.
Okay, excellent. And as far as family history, just the main things, you know, mom, dad, any siblings, if they're alive, do you have any health history of cancers or things like that nature?
Yeah, so dad's easy, unknown.
Okay.
So couldn't really track anything there. Mom is generally healthy. She's 71, and she did have a acoustic neuroma about 20 plus years ago. That has caused, residual
Okay,
health concerns there, but no, generally she's pretty healthy as well. Then I have a younger brother, 5 to 6 years younger than me, and he's in great health.
okay. And so as far as you know, no diabetes, heart disease, hypertension, stroke, epilepsy, anything like that in the family? No. Okay, and how about your diet and exercise? You know, what does that look like? How many days a week would you say you're exercising or trying to stay active?
Yeah, I shoot for 5 days a week.
Okay,
Some sort of physical fitness, or like get out and move in some capacity. And then diet it's hit or miss. I'm kind of at mercy to whatever they serve me
okay,
sometimes. So yeah, I'm trying to work on that. Clean it up a little bit.
So we're gonna start with a general kind of like just a review of your systems. So I know you said that your right ear is bothering you. Is
Mhm.
there anything else? I'm just gonna kind of briefly go down. Eyes, ears, nose, throat. You don't have any problems or complaints that you can think of?
No,
Okay, how about anything going on with your skin? Do you have any sores, any itching, any, problems in your scalp, your hair?
no, not that I've noticed.
Okay, excellent. Your breathing seemed to be okay. You haven't experienced any coughs lately, nothing like that.
I have not.
All right, no major weight loss over the last year.
I wish, but no,
Okay, excellent. Breathing seems to be okay.
it does.
Okay, how about any urinary or bowel symptoms? Are you using the restroom okay?
Yeah, no, definitely.
And you're regular?
Yeah.
Okay, any cramping when you're working out or anything, or muscle soreness that seems abnormal to you?
Nope.
All right, any balance problems?
Mhm.
Okay, and no swelling in any extremities or anything, your range of motion seems to be okay?
It does.
All right, excellent. So it's what I'm gonna do, we're gonna go ahead and start, like I said, we're gonna do a head to toe assessment, and then we'll check out that ear. We'll follow up with a plan. Does that work for you?
Perfect.
All right, great. All right, so the first thing I'm gonna do is I'm just gonna start at your forehead, okay? Checking your scalp, no pain in here, nothing going on.
Nope.
You never had any issues like when you got struck in your head, no stitches or anything?
No stitches.
Okay, any pain here?
Mhm.
How about here?
Mhm.
All right, go ahead and touch your chin to your chest, please. No pain?
Okay.
All right. I'm gonna feel your jaw right here. Go ahead and open your mouth. Close, open, close. All right, good. Nothing under here.
Mhm.
All right, go ahead and swallow for me. All right. All right, first thing we're gonna do is we're gonna have you stand up for me. You see our eye chart across the room. Are you wearing any contact lenses right now?
I'm not,
Okay, so go ahead and cover your right eye
but I,
and tell me the lowest line that you can read from left to right, please.
lowest line DEFPOTC.
Okay, great. Now uncover that eye, cover your left eye, and go ahead and tell me the lowest line that you can read, but let's go right to left.
Same line. You said right to left.
Yes.
CTOPFED.
Okay, great. Uncover that eye using both eyes. Tell me what's the lowest line you can see.
It's gonna be the same line. Right to left, right to left, right.
Left to right's fine.
Okay. DEFPOTC.
Excellent. All right, have a seat for me, please. All right, I want you to look right here, go straight ahead. I'm just gonna look in your, this is the eye that has the problem, right?
It is.
Oh yeah, I see a little bit of the scarring. All right. All right, I'm gonna have you follow my finger. All right, great. I'm gonna go ahead and hold some fingers out. Just tell me how many fingers I'm holding up, okay?
One.
Mhm.
2. 1. 2.
All right, good job. All right, so at this point, I'm gonna take a look into your eyes, okay? Correct. Sorry, just a light. All right, I'm gonna take a look at your ears. All right. And I'm gonna look up your nose. If you can just tilt your head back for me. All right, stick out your tongue for me. Left to right. All right, tilt your head back a little bit, say ah. Stick your tongue way out. All right, open your mouth for me. When's the last time you had a dental exam?
6 months.
Okay.
No, I'm
Everything's,
sorry, last month.
last month?
Last month.
Everything's okay there?
Yeah.
All right, I'm gonna go ahead and stand behind you. I want you to cover this ear for me,
This here?
just with your hand, yeah.
Okay.
And I'm going to whisper a word and I just want you to tell me what that is, okay?
Okay. Frog.
All right, good job. Cover the other ear. And I'm gonna go ahead and make a different word up. Tell me what you hear.
Snake.
All right, good job. All right, so checked here. All right, good job. So I'm gonna go ahead and have you hold your hands out for me. I'm just gonna check your extremities, check your skin out. You said you didn't have any concerns.
I do not.
All right. No pain in your legs,
No pain.
no pain in your feet.
No pain.
All right. All right, go ahead and take a deep breath for me. Again. Again. And again. No pain here.
No pain.
How about any pain here?
Mm.
How about here?
None.
No pain?
None.
All right. Go ahead and take a deep breath for me. Deep breath. One more time. All right, just breathe normal. All right, right here. All right, good. All right, you can go ahead and lay back for me. I'm gonna check out your abdomen, okay?
Okay. Sure on.
Yeah, I'll lift it up if that's okay.
Okay.
Okay, I'm gonna start first by just looking, okay?
Okay.
And you haven't had any abdominal pain or anything?
No.
All right, I'm gonna feel, okay? No pain?
None.
No pain?
None. Sorry.
Okay. Good job. Any problems urinating, going to the bathroom?
Mm-mm.
No frequency, no penile discharge,
Mm-mm.
BMs are normal.
Seem to be.
Okay, and how about your sexual health? Everything okay there?
Yeah,
Any tried and have any kids? Everything's fine.
yeah, everything's great.
Okay, I read that you had a vasectomy.
That's true, yes.
Okay, excellent. Sit up for me.
Mhm.
All right, I'm gonna check out your legs while you're here. Go ahead and squeeze your quad for me. All right, this side. All right, and you said no pain.
No pain.
Checking your pulses. All right, the next thing I'm gonna have you do, go ahead and raise your eyebrows for me. Close your eyes, open them. Excuse me, pop out your cheeks. Open your mouth, send your tongue out left to right. All right, raise your hands up in the air. Wave them around like you just don't care, just kidding. All right, hold them out in front of you. All right, good job. Go ahead and lay back once more for me. Straighten this leg out, raise it up about 6 inches, hold it. All right, relax. Same thing on this side. Okay, relax. Pull. Don't let me pull against you. There you go. Push down like you're driving a car. All right, good. Go ahead and sit up. All right, the next thing we're gonna do is I'm gonna check out your musculoskeletal, okay? So if you can go ahead and stand up for me. Shrug your shoulders. All right, down. Raise your arms out, back and forth. Can you touch your fingers to your nose? All right, up and down this way. All right, good. So I'm gonna have you back up over here for me. And I want you to walk in a straight line, heel to toe.
Like that.
Yep.
I have slow reflexes. I
Okay.
feel like I'm gonna fall over.
Turn around. All right, I want you to go up on your tiptoes.
Like that.
Yep, perfect. And walk back. All right, great. And the last thing I want you to do is get down and kind of do a duck walk, probably like you did in boot camp.
Okay.
All right, awesome. All right, go ahead and have a seat back down for me. All right, I'm gonna go ahead and check your reflexes out. So just, the key to this is just to be as relaxed as you can, okay?
Okay.
All right. What? Here we go. And then. All right, good. Same thing on this side, just try and relax. All right, check your knees, just try and relax. Good. All right. So everything looks great today. For your ear, I think the best course of action, typically we just kind of let it resolve on its own. I do see some fluid behind there. So the best thing I think we can do right now is to start you on an oral steroid. Have you ever taken oral steroids before?
Yeah.
Okay. And so it's going to be a dose pack. So it's going to be like 6 pills, 5 pills, 4 pills, 3 pills, 2 pills, and 1 pill. It's important that you try and take all of them. Some people report that they kind of make them anxious or they can't sleep as well. Hopefully you're not one of those people, but just to be aware if that does happen, it's most likely from the medication, okay? Obviously, if something happens, call and let us know, and we can try and go from there. Also, I'm going to give you some Afrin. I want you to use the Afrin, 2 squirts every 12 hours, but only for 3 days. And when you do that, I kind of want you to hold your nose and blow to try and get up in the eustachian tube, okay?
Okay.
We'll follow back up within 8 to 10 days to see how you're feeling, or if that's let go, and if not, then we'll kind of go from there and see what we need to do. Maybe you need to get a referral to an ENT.
Okay.
I'll have the nurse give you some information on some smoking cessation.
Yeah.
And then also some information on our counselors, just for the anxiety, or just maybe, and if you can get some tips how to work through that and work on that. How does that sound?
No, sounds great. I'm sorry, I forgot to mention too, just general knowledge. As I'm getting older, I'm noticing like posture's getting worse. Is there anything that I need to be concerned about? Any reason? I don't know. I feel like the older I get, the more I'm hunched over.
Okay,
Maybe just
sure.
because I sit poorly.
Yeah, try and always keep your shoulders back,
Okay.
tall, keep your torque tucked in, but stand up straight. Let's check out your spine. All right, go ahead and lean over at the waist and touch your toes.
Okay.
All right, no pain, right?
No pain.
All right, so stand up. So your spine is nice and straight.
Mhm.
So I think just habit when you're on your computer, we tend to,
Right.
to
well,
do
that's where I
this.
spend a lot of my time. So.
yeah, so just try and be cognizant of keeping back. Some people sit on like a med ball.
Okay.
That could be, if you feel like you're up for that all day. Some people stand
Yeah.
to type with those
I'll ask my
desks.
office about a new desk.
Yeah, so all those things can help. Just try and stay as active as you can.
Okay.
All right, so it was very nice to see you again.
You too.
And I'll see you hopefully next year.
Sounds good.
All
Thank you.
right, great, thank you.